Clendenin is an epidemiologist at Texas A&M School of Public Health, and she joins me now from College Station, Texas. Angela, good to have you on the program with us. After that Pfizer announcement, the FDA and CDC made a joint statement contradicting the pharmaceutical companies, saying Americans don't need a booster shot yet. Why do you think they came out with that statement? Because it was a bit unusual.
I think really the reason why they made a joint statement about the need or lack of need for a booster shot right now is, quite frankly, we only began distributing vaccines to people back in December. So we have about 6 months, 6.5 months worth of data. And we just don't know truly how long those neutralizing antibodies are going to last. And we need more evidence before we can see that we need a booster.
Yeah, it really is all very new. As you said, people who got vaccinated right at the very beginning, it's only been 6 months. But it might be confusing for people to hear this, kind of mixed messaging. Should people who are fully vaccinated be worried about the potential for waning immunity?
I think right now it really is still too early to tell. When we look at our annual flu vaccines, the efficacy range on the annual flu shot is between 40 to 50%, and we tend to get a new one every year. The Pfizer and Moderna vaccines have proven to be very effective. They do provide protection against even the Delta variant that has everybody concerned right now. I do think we should be looking at boosters, but maybe for not until next year. I think we need to work harder to make the vaccine more available to more people around the world if we really want to try to prevent COVID from spreading.
Yeah, and to your point there, we do still have a long way to go before enough people are vaccinated to reach what scientists say is herd immunity. If it does come to the point where we do need a third booster shot, should people who are more vulnerable get a third shot before some others have even gotten their first?
I really think it's important that we try to get a first dose in everybody, because we've seen that some protection is better than none. And then after that point, when we feel reasonably comfortable that everybody, as many people as possible, have had a first dose, then we can go back and start talking about a third dose for those who are most vulnerable.
We hear a lot of talk about these new variants. It seems like there's a new one that pops up every day: Delta variant, Lambda variant, Epsilon variant. I mean, how concerned should we realistically be about these variants, and if they can evade vaccines?
Well, when you talk about viruses and variants and you hear the term the virus mutated, it can be very kind of scary for a lot of people, very concerning. People hear mutation, they think about X-Men or something like that. But that's what viruses do. They mutate. They try to find this mutually beneficial hotspot where they can survive in a host. So it's not in their best interest, of the virus's best interest, to mutate so much that they destroy the host. But at the same time, as the host changes to eradicate the virus from their body, it does have to adapt. And so becoming more transmissible is one of those ways that a virus can adapt to be able to survive. What we really need to be thinking about is our ability to care for people with COVID. So if we have a lot of severe disease, it can make a tremendous burden on our healthcare infrastructure, versus if we have a lot of people with mild disease. So I think at this point, we need to be watchful about these new variants and to see what makes them different. But right now, I don't think there's a need to be, alarmed. Concerned, yes, but not alarmed.
Okay, all right. Some great advice there. Angela Clendenin joining us from College Station, Texas. Thank you so much.